If your doctor asks you to repeat a blood test, don't panic. Many patients immediately become worried when they hear this and start thinking that it's because the doctor has discovered something very serious. Others think it's because the laboratory has made a mistake. But the truth is, repeating a blood test is actually a very common and important medical decision that doctors make. Because one blood test result does not always tell the full story about what is happening inside your body. Your body is constantly changing. Hydration, stress, infection, medications, and even what you eat before the test can affect the numbers that will appear on the laboratory reports. And sometimes the result that looks abnormal today may return to normal tomorrow. This is why we usually rarely rush into a major diagnosis based on just one test result. Instead, we repeat the test to confirm whether this result is truly real or just a temporary change. For example, someone may appear to have abnormal kidney test result simply because they were dehydrated. Blood sugar level may remain high just because someone ate before the test. Even certain medications or mild infections can temporarily change blood results. So, repeating the test helps us to answer a very important question. Is this test result showing a real medical problem, or is just a simple temporary change in the body? However, there is another reason why we usually repeat blood tests, and many patients don't realize this. Even in modern laboratories that are very accurate today, small problems occasionally affect a sample. Sometimes a blood may clot before the test is being conducted. Sometimes the sample might have stayed too long on the shelf before it's being processed. Sometimes a patient that is supposed to fast, but the patient didn't realize it was required. So when the result looks unusual, we may decide to repeat the test simply because we want to be sure that the number we are seeing is reliable before making a very important medical decision. Because in medicine, treatment decisions should never depend on a result that might not be completely accurate. And there is one more reason why doctors usually repeat a blood test that is extremely important, especially for people living with long-term medical conditions. Sometimes, the most important information in medicine does not come from a single test. It comes from watching patterns over a long time. So we usually repeat blood tests